When Mount Nittany Health first learned of the need for a children's advocacy center here in the center region, we immediately got involved and agreed to sponsor the startup and operation of the center. Since the center's inception, we are honored to have been able to support and serve over 1,500 children and families who come to the center seeking a safe and comfortable place to begin their healing process. Of course, we wouldn't be where we are without the support of many wonderful community organizations. Their time and talent are what make the center a special place, and we're deeply grateful for their partnership.
The mission of the Children's Advocacy Center is to serve the children and families within our community. We use a multi-disciplinary approach to the identification, intervention, prevention, investigation, as well as the treatment of child abuse and violent crimes towards children. Our primary focus is on the child's well-being.
Hello, good morning.
Our team works very hard to ensure that these children feel safe and secure when they are coming here to share their account of the abuse, neglect, or if they've been witness to any other violent crime.
The Children's Advocacy Center is a child-centric location where all the pieces come together to both evaluate and treat a child who has potentially been abused.
So our team today is made up of...
We are the coordinating piece to the child abuse investigation. We've really pulled together all the investigative teams and the healing components.
The healthcare system, the legal system, the criminal or civil justice system, law enforcement, those systems are pretty confusing. We have a group of victim advocates and one specially dedicated to working at the Children's Advocacy Center. And advocacy really is a way to help the systems be more responsive to the needs of the individual.
The CAC conducts interviews and medical exams for a wide variety of cases, including physical abuse, sexual abuse, violent crimes, and kidnapping.
And this is a safe room. Hello.
The forensic interview is the core of the program. The forensic interviewer is specially trained to ask them questions in a way that helps them feel heard and validated, and in a way that is legally sound.
The medical exam is non-invasive. It is very similar to a well-child visit exam.
So if you have any questions.
Our doctors are trained specifically for this exam, and we do everything we can to make sure the child is comfortable. The visit is designed so that everything can happen at one visit.
All of this information is collected at one time, and it can be shared with our legal system. The intent is to avoid multiple encounters with multiple teams involved in the support of the child.
It's not just okay to focus on catching the person or identifying the person who did it and getting enough evidence to hold that person accountable. It's also always and must be what's in the best interest of the child.
We're definitely going to follow up with.
We all have very different roles to play in an investigation, but I think what's really important is that we all understand the roles that each other plays.
I would advise any family seeking our services to know that we do take a very team-centered approach, but always at the forefront of our mind is their child's well-being, safety, and comfort.
If you or someone you know suspect abuse or neglect of children, please call the Center County Office of Children and Youth Services or call the Child Line. If you'd like to make a donation to the Children's Advocacy Center, please contact the Foundation for Mount Nittany Health.